Hi, I'm Hilary Talbott, acupuncture physician and clinical herbalist. Today we'll be discussing acupressure and the spleen. Now, why would you want to stimulate the spleen? Perhaps you've overcome an illness such as mono, or you've had some type of blood disorder like anemia, or an issue with your platelet count, perhaps after chemotherapy. Stimulation of a point that has a direct connection to the spleen could help with blood production, as well as normalizing of the size if the spleen becomes enlarged as a result. The point I'm going to show you today is liver 13. It is the front shoe point of the spleen. It's also a diagnostic point, so if there's something happening with the spleen, it's often very tender when I palpate this point on a patient. This point is found by finding the border of the ribs and just sliding your hand down until you get to the first free-floating rib. And you just kind of want to push your fingers around gently until you find it, because it's, like I said, this point can be pretty tender. And on our model today, it is right here. And this is something just really by trial and error that you're going to have to find this point on yourself. There's also another free-floating rib a little bit further back here on the side, and that point is also really tender too. So the first point right here, liver 13, and you want to just use gentle stimulation, especially if you've got something actively happening with the spleen, but you could be using it preventatively or as a way of recovering. This point is, of course, located on both sides, so even though the spleen is on the right side, we could use the point on the left or the right based on channel theory to affect the organ itself. There are various other points that could have a direct connection into the spleen, and I encourage you to seek out your local acupuncture physicians to find those out for yourself. I'm Hilary Talbott, and that's Acupressure for the Spleen.